Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain neurofibromatosis. The link between ophthalmology and neurology is very important. The eye, as a light-perceiving organ, is a sensory organ that is linked to the nervous system, and it is located very close to the brain. So when a brain develops any pathologies like increased intracranial pressure, this can directly affect the eyes. The eye is also innervated by 4 out of 12 cranial nerves, 2 perceiving light, and 3, 4, and 6 responsible for extraocular movement. And the retina also has a neurosensory layer that eventually becomes the optic nerve as it exits the eye. Neurofibromatosis is a disease that involves the embryonic ectoderm that leaves pigmentary birthmarks and skin lesions to the newborn. Therefore, it is a neuroectodermal system disorder affecting the melanocytes and peripheral nervous system support cells called Schwann cells. And these lead to hamartomas on the neural, cutaneous, and ocular regions. Neurofibromatosis type 1 is also known as von Recklinghausen's disease, and this involves mutations in the neurofibromin gene. Type 2 is also known as bilateral acoustic neurofibromatosis, and this in turn involves mutations in Merlin or schwannomin gene. The presentation of neurofibromatosis involves the eyelids in terms of the eye. So definitely pause the video, have a closer look at the different components within the cross-section of the eyelid. Neurofibromatosis is a disease that can be passed down the family tree. So type 1 involves a mutation in the Q arm of chromosome 17, and type 2 mutations include the mutations in the Q arm of chromosome 22 from the region 11 to 13.1, which is also known as the Merlin gene. Criteria exists for each type of neurofibromatosis. Type 1 would be at least 2 of the following list. 6 or more cafe au lait spots that is 5 millimeters in diameter or more in children. 2 neurofibromas or more, or 1 plexiform neurofibroma, axillary or inguinal freckling, optic nerve or tract glioma, 2 or more iris lesion nodules, osseous lesion, and first degree relative with neurofibromatosis 1 with these criteria. Type 2 is a bilateral acoustic neuroma, and first degree relative with neurofibromatosis type 2, as well as either a single acoustic neuroma or 2 of the following: glioma, neurolemoma, meningioma, neurofibroma, and premature posterior subcapsular cataracts. So understandably, the symptoms of neurofibromatosis is similar to the ones described by the criteria. So systemically in type 1, you will see cafe au lait spots, CNS and spinal cord gliomas, meningiomas, intracranial calcifications and intellectual deficits, kyphoscoliosis, and pheochromocytoma, which is epinephrine-releasing tumor. In the eyes, you may find lesion nodules, which is iris melanocytic hamartomas, eyelid cafe au lait spots, neurofibromas, diffuse uveal thickening, choroidal hamartomas, optic nerve glioma, and retinal astrocytic and combined hamartomas. In type 2, the systemic presentations would be similar, and intracranial calcifications, as well as bilateral acoustic neuromas, can also be spotted. And in the eyes, premature posterior subcapsular cataracts, retinal hamartomas, optic nerve meningioma, glioma can be found, but no lesion nodules will be spotted in type 2. The differential diagnosis for the neurofibromatosis may include neurofibromatosis 1-like syndrome and familial cafe-au-lait spots. So do a complete ophthalmic history from the patient and pay attention to any family history of the similar symptoms or even neurofibromatosis directly. Assess color vision and tonometry, measure the visual acuity, and pay attention to the visual fields. With the slit lamp exams, pay attention to the lids, cornea, iris, and the lens. The investigations for neurofibromatosis include the CBCN lights, urine metanephrines, brain and orbital MRI and CT, as well as audiography for type 2. Treatment for neurofibromatosis include genetic counseling and routine eye exams to look for cataracts, glaucoma, and other malignancies in the eyes. Surgically, we have the option to remove eyelid fibromas, but these have a high recurrence rate. So hopefully we were able to show you that neurofibromatosis demonstrates this important link between ophthalmology and neurology. Here is a summary chart of everything we have talked about with regards to neurofibromatosis. Here is a reference from which we have pulled the information for neurofibromatosis. And here are the reference for the pictures that we have used. So thank you for watching this video.